I'm Dr. Jawetz, and I'm here to talk to you today about ear infections. So, I'm holding in my hand here a cutaway model of a human ear, and the important parts for our discussion today, you can see this is the ear canal, the part that you can see when you look at somebody's ear. Inside here is the eardrum. This is where the ear infections take place. This is what we call the middle ear. And then back here are what are called the semicircular canals, which is how your body maintains its balance. That's what's called the inner ear. Ear infections are infections of this space, the middle ear. And that's, again, what we're going to discuss today. The way that ear infections occur is usually when you have either a cold or allergies. Typically what happens is that this tube over here, which is called the eustachian tube, gets swollen from the inflammation from either the cold or the allergies. When it swells, the fluid that normally sits back here to help the ear transmit sound can't drain properly, and it just sits there. When it sits there, bacteria that are in the back of the mouth, which would be down here, are capable of going up the eustachian tube and making an infection behind the eardrum. When you get an infection behind the eardrum, pus develops, that pus pushes against the eardrum, and that causes pain. And that's what causes your child to feel uncomfortable. The typical symptoms of an ear infection would be ear pain, and sometimes fever, although not always. In young infants, sometimes they'll pull on their ears, but sometimes they won't. It's not always a very good sign. Other signs can be that the child may not feed well if it's an infant. Older children are usually actually capable of telling you which ear hurts, but again, in a younger child, not always. The typical treatment for ear infections is, first of all, to treat the discomfort. The best way to treat the discomfort is with either Tylenol, acetaminophen, or Advil or Motrin, or ibuprofen, which is the generic name. That usually can control the pain. Something else that can be done in the middle of the night if your child wakes up complaining of ear pain is to actually take some olive oil. Olive oil can be warmed up, probably best either on the stovetop or carefully in the microwave to being warm. It shouldn't be hot. If it's hot, you can burn yourself, obviously. And then that warm olive oil can actually be instilled in the ear canal with a dropper. Putting a couple of drops of warm olive oil will coat the eardrum. By coating the eardrum, that'll help take away some of the discomfort. And then the child can usually make it until the morning. When we see a child in the office and we look and we see that they have an ear infection, depending on how old the child is, we may do different things. For children under a year, the typical course of treating an ear infection is with antibiotics. However, for older children, there is an option to do what we call watchful waiting. Watchful waiting means that we'll often give it 2 or 3 days before starting the antibiotics. And the typical reason for starting antibiotics would be if that child hasn't gotten better after 2 or 3 days, if the child has a fever of over 102, or if that child's discomfort cannot be controlled with either Advil or Tylenol. In that case, we typically start with amoxicillin, which is the pink bubblegum medicine that you all know and love. In children who have multiple ear infections in a short period of time, we'll often go to stronger medicines like Augmentin or Omnicef. For children who have frequent ear infections, sometimes we require a visit to an ear, nose, and throat specialist. What can be done for those children is that they can actually have tubes, which are little plastic, almost button-like objects that can be inserted into the eardrum. These tubes allow the pus that builds up behind the eardrum to drain so that there's no pain and so that the child doesn't get fluid buildup back there and therefore they don't get ear infections anymore. In certain cases, children who have recurrent ear infections may also need their tonsils and adenoids taken out because when the tonsils and adenoids are too big, they'll again block this eustachian tube and not allow that fluid to drain, and therefore they get sick. And that's generally the best way to deal with ear infections. Most children can be treated successfully with antibiotics. It's fairly rare that they need surgery, but that is always an option if need be. And generally, after your child has an ear infection, we would recommend coming back to the office in 10 to 14 days to have the ear rechecked, just to make sure that the infection is completely cleared. Sometimes children can have some fluid that will persist, and we generally will follow that in the office, but that usually goes away by itself. And that's pretty much the story about ear infections.